Have you ever heard someone talk about a disease but you don't know what it is? Well, after this, you can officially mark one off of your list. New rare diseases are discovered all the time, and the one I'm going to cover today is called Alexander disease. To know all about Alexander disease, you need to know what it is, signs and symptoms, and how to treat it and prevent it. According to RareDiseases.com, Alexander disease is an extremely rare, usually progressive and fatal neurological disorder. Initially, it was detected most often during infancy or early childhood, but as better diagnostic tools have become available, it's been found to occur with similar frequency at all stages of life. About 95% of Alexander disease cases are caused by mutations in a gene called GFAP. GFAP is a structural protein called glial-fibrillary acidic protein that's found exclusively in astrocytes in the CNS. The other 5% of the cases are still unknown. The part of the brain that this disease affects is a fatty material called myelin, which forms an insulating wrap around nerve fibers called axons. There's a marked deficit inside of the myelin in onset patients with this disease, and in later onset patients, it can affect the frontal lobes. One way of detecting this disease in the brain is by MRI scan. According to WebMD.com, an MRI is a test that uses powerful magnets, radio waves, and a computer to make a detailed picture of the inside of your body. If you're like me, you've never seen an MRI performed before, so here's a tutorial for us to watch.
That's where a magnet takes the best pictures. MRI machines typically sound like a loud jackhammer. Lots of loud knocking noises. To protect your hearing, we give you earplugs and or headphones. The headphones will cancel out the noise of the machine. Next scan will run. These headphones also allow the MRI technologist to let you know how long each exam will be. If you ever have any questions in between the scans, they're able to hear you through those headphones. We give you an emergency call button. So if at any time you just decide you do not want to do the exam anymore, you can squeeze the call button and we come in and get you out. It is much more common to be claustrophobic than I think anyone realizes. We have lots of practice as technologists with patients who experience claustrophobia. Our biggest technique is standing right next to you the whole time while we get you in position, while you're moving into the scanner, and then we make sure that you're comfortable before we step away from the scanner or step back to start the exam. And that's another reason why we give you that call button. It's for your peace of mind almost, to let you know that you can squeeze that ball at any time and we'll bring you out of the scanner. You're doing a great job. We're on the other side of the door, so if you ever need anything, all you have to do is speak up and we can hear you.
In some cases, a DNA analysis can be done to detect this disease. And although a DNA analysis may point to some other mild diseases, unlike Alexander disease, with knowing what the analysis says, you can watch out and determine if this particular disease that you do have turns into Alexander disease. To know exactly what to expect with Alexander disease, you need to know the signs and symptoms. There are two types of this disease, type 1 and type 2. Type 1 of Alexander disease causes failure in growth and can delay weight gain. This is mostly seen in infants and small children. To show you what a failure to thrive child looks like, here is an example. It can also cause delays in mental, physical, and behavioral skills that are required at this stage of life. This disease can also cause seizures, which is uncontrolled electrical activity in the brain. They can cause issues in development, such as speech and the ability to comprehend things. Not many people know what to do when they see someone having a seizure, and I feel like this is something everyone should know. When someone is having a seizure, you need to roll them on their side and try to make sure their airway is clear as soon as the seizure has ceased. In this demonstration, they will show you exactly how to help someone when they are having a seizure.
If you suspect someone is having a seizure, it's important to protect them from harming themselves during the fit. Clear away any potential dangerous objects like hot drinks or sharp objects. Don't restrain or move them. Make a note of the time when the seizure started and how long it lasts. Protect their head by placing something soft underneath or around it, like a towel, and loosen any clothing around their neck. Once the seizure has stopped, open their airway and check their breathing. If they're breathing, put them into the recovery position.
People with type 2 Alexander disease rarely show delays and can even be confused with sclerosis or tumors in the brain. And lastly, treatment and prevention of this disease is tricky. Treatment for this disease is limited, but one thing that you can do is genetic counseling. Genetic counseling is a benefit for the patient and for their family. Unfortunately, there's no cure for this disease at this time, but the symptoms are manageable. There really is no preventing this type of disease, but something to keep in mind for new moms is to take their prenatal vitamins and don't do things that you know are wrong and could harm the baby and its development. Overall, Alexander disease is something to look for when your child is younger, and although it can be hard to detect some of the symptoms, this disease is something to talk to your doctor about if you see any type of deficiencies in your child. Never heard of this disease? Well, you probably haven't heard of a lot of diseases, so dig into some research and learn all about them to see what you can watch for in your growth and others.